Good afternoon and welcome to the Senate Committee on Health and Human Services for the 83rd Legislative Session. Madam Secretary, please proceed to call the roll.
Senator Lang, Senator Stone, Senator Taylor, Senator Titus, Chair Doñate.
And I am here. Thank you so much. Please mark everyone present. Good afternoon, everyone, and thank you so much for joining us here today. Today, we have a lot of business to get through, including a few bill hearings, as you may know, a work session, and a special surprise. So we'll have, hopefully, we get to, you'll catch a part of the agenda that we're going to have that special surprise. I do have a few housekeeping items, if we can go through this really quickly, seeing because there's a lot of things that we're going to have to go through today. First and foremost, please note that the agenda items may be taken in a different order than listed. Today, my goal is to do Assemblywoman Edgeworth's bills first. I'll do 315, 380. Oh, sorry. We'll start with 161, 315, and then 380. And then we'll do the last one, AB 448 last, considering that one will take a little bit more time. And then, but before we do that, I believe I'm going to start with the work session, and then maybe our special surprise, and then we'll do the bills. So that's the order for today. For those of you who wish to testify, I ask that you please sign in at the table by the door and provide a business card to the committee secretary. If you do not wish to testify, you may still do so and sign in so that there's a record of who is interested in a particular bill in the event the committee needs to contact you later. When testifying today, please turn on your microphones on to speak and off to listen, and we have listeners and viewers in Las Vegas and online as we are recording this meeting. We ask that public comments be kept to 2 minutes so that everyone interested in speaking can be accommodated and we can get through the agenda in a timely fashion, and speakers are urged to avoid repetition of comments made by previous speakers. And finally, we ask for folks to please turn off their electronic devices. Same as usual that we've done this legislative session, each presentation is 15 minutes, followed by a 15-15-15 breakdown of 15 in support, 15 in opposition, and 15 in neutral. It's the same thing we've done all throughout this session. Let's start first with the work session, if you give me 1 second. All right, let's go ahead and begin with AB 19. Ms. Cooper.
Thank you, Chair. Assembly Bill 19 revises provisions relating to the statewide substance use response working group. It's sponsored by Assembly Committee on Health and Human Services on behalf of the Attorney General. It was heard in committee on April 29th, and in summary, it revises the membership of the statewide substance use response working group and provides staggered initial terms of new members. There was an amendment proposed by the Attorney General's office, which revises the report date. Thank you.
Thank you so much, Ms. Cooper. Any questions from committee members? This is a amend do pass. Do I have a motion?
So moved.
We have a motion from our Vice Chair, second from Senator Lang. Any discussion on this bill? All those in favor, please say aye. Aye. Any opposed? Nay. We have 1 nay from Senator Titus. The motion's carried, and I will take the floor statement. Let's move on to AB 36. Ms. Cooper.
Thank you, Chair. Assembly Bill 36 revises provisions relating to Medicaid. It's sponsored by the Assembly Committee on Health and Human Services on behalf of the Division of Healthcare Financing and Policy of the Department of Health and Human Services. It was heard in committee on April 24th and requires a service provider under the state plan for Medicaid to request a hearing within 90 calendar days after the date of notice of action taken against them by the Division of Healthcare Financing and Policy of the Department of Health and Human Services unless extenuating circumstances exist. This bill requires the division to adopt regulations prescribing the actions on which a service provider may request a hearing and the circumstances that constitute extenuating circumstances. Thank you.
Thank you, Ms. Cooper. This is, first of all, do you have any questions? This is a do pass. Do I have a motion?
So moved.
We have a motion from Senator Titus and a second from our Vice Chair. Any discussion? All those in favor, please say aye. Aye. Any opposed? Motion's carried. And now I will assign that floor statement to Senator Taylor. Senator Taylor.
We get mixed up all the time.
Let's move on to Assembly Bill 42. Ms. Cooper.
Assembly Bill 42 revises provisions governing the adoption of regulations for the administration of certain programs of public assistance. It's sponsored by the Assembly Committee on Health and Human Services on behalf of Medicaid and was heard in committee on April 24th. Assembly Bill 42 authorizes the Administrator of Medicaid and Policy to adopt, amend, or repeal a regulation or policy with 3 business days' notice if the intended action 1. Ensures compliance with a federal or state law, or 2. Expands services or benefits. No amendments were proposed. Thank you.
Thank you, Ms. Cooper. Do we have any questions from the committee members? Seeing none, this is a motion to do pass. We have a motion from Senator Titus, a second from Senator Stone. Any discussion? All those in favor, please say aye. Aye. Any opposition? Motion's carried. I will go ahead and take that floor statement. Let's go to Assembly Bill 107. Ms. Cooper.
Assembly Bill 107 revises provisions relating to foster care. It's sponsored by Assemblymember Brown, May, etc., and was heard in committee on May 1st. Assembly Bill 107 revises background check requirements for foster home license applicants, licensees, employees, and adult residents. The bill provides that such background checks do not include determining whether a person has been arrested for, has charges pending for, or has been convicted of certain violations involving the possession of marijuana not for sale if the violation occurred more than 5 years prior. No amendments were proposed for this measure. Thank you.
We have a motion. Do you have any questions? We have a motion from Senator Lang, a vice chair from from our vice chair. This one is due pass. Do we have any questions? All those in favor, please say aye. Aye. Any opposition?
Nay.
We have one opposition from Senator Titus, and the motion's carried. I will take that, assign that floor statement to Senator Lang. Let's move on to Assembly Bill 176. Ms. Cooper.
Assembly Bill 176 revises provisions relating to reproductive health care. It's sponsored by Assemblymember Torres Fawcett and was heard in committee on May 8th. Assembly Bill 176 generally prohibits certain governmental entities from enacting or implementing any limitation or requirement that singles out reproductive health care and substantially burdens access to services or the ability of a healthcare provider to render care. A governmental entity may enact a limitation or requirement if there is clear and convincing evidence that the burden furthers a compelling interest and is the least restrictive means of furthering that interest. There was an amendment proposed by Assemblymember Torres Fawcett, which revises Section 6 to replace reproductive health care with contraception and family planning services, and then makes conforming changes throughout the bill. Thank you.
Thank you so much. Any questions? No questions. We have a motion to amend and do pass from Senator Titus and a second from Senator Lang. Any discussion? All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will assign that floor statement to Senator Titus. Let's move on to Assembly Bill 266. Ms. Cooper.
Assembly Bill 266 makes revisions relating to breastfeeding and is sponsored by Assembly members Gonzalez, etc. It was heard in committee on May 1st, and Assembly Bill 266 requires DHHS to post certain resources relating to breastfeeding on its internet website. The information must include a fact sheet about available Medicaid coverage and community resources for lactation support. Additionally, DHHS must develop and carry out a public education program to increase awareness about lactation, including its health benefits and ways pregnant people and parents can connect to lactation support. Finally, this bill prohibits a person who is breastfeeding from being denied the full and equal enjoyment of a place of public accommodation and makes it unlawful for a place of public accommodation to publish a statement, advertisement, notice, or sign that conflicts with that prohibition. No amendments were proposed. Thank you.
Thank you so much. Do we have any questions? Seeing none, this is a motion of due pass. Do you have a motion? We have a motion from our vice chair, second from Senator Lang. Any discussion on this bill? All those in favor, please say aye. Aye. Any opposed? We have one nay from Senator Titus. Motion's carried, and I will take that floor statement. Let's move on to Assembly Bill 343. Ms. Cooper.
Assembly Bill 343 makes revisions relating to health care and was sponsored by Speaker Yeager. It was heard in committee on May 6th. In summary, Assembly Bill 343 codifies federal hospital price transparency regulations, among other provisions. Specifically, this bill requires hospitals to compile, publish, and annually update a list of certain provisions. Furthermore, this bill prohibits a hospital from taking certain actions to collect a medical debt if the hospital is not in compliance with price transparency requirements. And finally, before taking any action to collect medical debt, certain healthcare entities are required to provide a patient with an itemized statement of medical debt and a receipt for each payment made on the debt. The bill sponsors proposed an amendment which, among other items, revises the definition of a hospital to conform with the existing definition in the NRS, removes the requirement to submit pricing files to DHHS, and makes changes to allow a hospital to deliver an itemized receipt electronically or through a digital portal, and changes a violation from this section. Thank you.
Thank you, Ms. Cooper. Committee members, any questions? This is a motion of amend do pass. Do I have a motion?
So moved.
We have a motion from our Vice Chair, second from Senator Lang. Any discussion on this bill? All those in favor, please say aye. Aye. Any opposed?
Nay.
We have 2 nays from Senator Stone and Senator Titus. The motion's carried, and I will take that floor statement. Let's move on to Assembly Bill 360. Ms. Cooper.
Assembly Bill 360 revises provisions relating to testing for sexually transmitted diseases and is sponsored by Assemblymember Golding. It was heard in committee on May 13th. And in summary, Assembly Bill 360 revises provisions relating to examinations of pregnant women for the discovery of syphilis. Specifically, this bill requires physician assistants and advanced practice registered nurses attending a pregnant woman during gestation to examine the woman for syphilis, as is currently required for physicians. Additionally, this bill requires certain medical facilities to test a pregnant woman for syphilis under certain conditions. And finally, this bill requires the director of DHHS, to the extent federal participation is available, to provide Medicaid reimbursement for testing for syphilis separately from other prenatal care a pregnant woman receives at the time of testing. No amendments were proposed. Thank you.
Thank you, Ms. Cooper. Do you have any questions? Seeing none, this is a motion of do pass. We have a motion from Senator Titus. We have a second from Senator Stone. Any discussion? All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will assign that floor statement to Senator Titus. Let's move on to Assembly Bill 368. Ms. Cooper.
Assembly Bill 368 revises provisions governing electronic communication devices and locations where certain services are provided. It was sponsored by Assemblymember Carter and was heard in committee on May 13th. Assembly Bill 368 authorizes a patient in a assisted living facility, a resident in a living community for people with disabilities, or their representative to request the installation of an electronic communication device in their living quarters if certain conditions are met. This bill prohibits anyone except the patient, resident, or representative from intentionally interfering with such device, forbids unauthorized access to recordings, prohibits an employee from refusing to enter living quarters because of the presence of such a device, and makes it illegal for a facility or community to discriminate or retaliate against a patient or resident for the installation. Additionally, this bill prohibits providers of supported living arrangements in the home from entering into a contract or agreement that prohibits installation. And then there was an amendment proposed by Assemblymember Carter that revises the definition. Thank you.
Thank you so much, Ms. Cooper. Any questions on this bill? Seeing none, this is a amend do pass. We have a motion from our Vice Chair, seconded from Senator Lang. All those in favor, please say aye. Aye. Any opposed? There's no opposition, and I will assign that floor statement to Senator Stone. Let's move on to Assembly Bill 484. Ms. Cooper.
Assembly Bill 484 revises provisions relating to the collection of data concerning providers of healthcare. It's sponsored by Assembly Committee on Health and Human Services and was heard in committee on May 6th. Assembly Bill 484 expands the required information the Director of the Department of Health and Human Services must collect from healthcare license, certificate, or registration renewal applications and compile into a database. No amendments were proposed. Thank you.
Thank you, Ms. Cooper. Any questions? This is a motion of do pass. Do I have a motion? We have a motion from our Vice Chair, seconded from Senator Lang. Any discussion? All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will take that floor statement. And Ms. Cooper, we've got to the last one, AB 519. Please begin.
Assembly Bill 519 creates a separate chapter of the Nevada Revised Statutes governing certain agencies and organizations that provide non-medical services. It was sponsored by the Assembly Committee on Health and Human Services and was heard in committee on May 8th. Assembly Bill 519 creates a new chapter in the NRS consisting of existing provisions for the licensure and regulation of agencies to provide personal care services in the home. Additionally, this bill revises the training requirements for certain caregivers who receive reimbursement through Medicaid and authorizes a Medicaid recipient's family member to serve as a personal care assistant under certain circumstances. Thank you.
Thank you, Ms. Cooper. Committee members, any questions? This is a motion of do pass. We have a motion from our Vice Chair, seconded from Senator Lang. Any discussion? All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will take that floor statement. That concludes today's rounds of our work session. we will have one tomorrow as well, possibly. So keep a lookout on that. But before we go on to our the rest of our agenda, I did mention that we did have a surprise for today. So as you may know, the role of being a legislator oftentimes is difficult and challenging because of everything that goes on in our legislative session. And folks know that this has been a very fast-paced legislative session, as has the previous ones. But I think all of us can agree, at least from my colleagues up here, that sometimes during the legislative session, I think one of our favorite things is our ability to take some time to pause and reflect and to thank people specifically for their service if they have dedicated some time of year to serving our people of our state. And so before we hear any bills and we move on to the later half of the agenda, I want to take the moment of privilege as a chair to share some remarks. And first and foremost, today, on behalf of the members of the Senate Committee of Human Services, it is our honor to present a proclamation to Ms. Cody Finney. As you may know, after 27 years of unwavering service to the people of Nevada, Ms. Finney, the administrator of the Department of Behavioral Health, is retiring. Throughout nearly 3 decades of public service, Cody has been a tireless advocate for shaping the public health of our state. She has been a steady hand during the times of crisis and a trusted voice in shaping policy that touches the lives of many vulnerable Nevadans. Today, the members of this committee are proud to present a formal proclamation in her honor, recognizing not only her professional accomplishments, but the compassion, integrity, and the dedication that she has brought to this very role that she has held, and of course through her service in the state. So please, if everyone can do a round of applause, not just thanking her for her service, but also for her leadership and for your determination. So thank you so much. And we'll go on recess really quickly just to take a photo with her. All right, we're back. Thank you so much for the indulgence of going through that. I think it was very meaningful for all of us. And I just, again, cannot express the gratitude that you have given us, not just in terms of your advice, but just for everything you've done for our state. We will go ahead and now proceed to the rest of the agenda, which is our bills. And so I will go ahead and begin with opening the bill hearing on Assembly Bill 161. So I'll invite the Assemblywoman to please begin when she is ready.
Good afternoon, Chair Janyate and the members of the HHS Committee. I'm Dr. Rebecca Edgeworth, REBECCA, EDGEWORTH. I'm proud to represent Assembly District 35, which is in Southwest Vegas, and I'm here today to present AB 161. It addresses the appalling state of hospices in Nevada, and hopefully we will improve care to people who are dying. As a physician practicing in Nevada for over 20 years, I've had to have conversations with patients about the end of their lives, about diseases that they won't recover from. The conversations with them and their families can be quite heartbreaking. I talk about hospice all the time with those patients. I've also had my own family members that have passed while in hospice, so this is a topic I'm very personal and I'm very passionate about. So for many years, most hospices in Nevada were nonprofit, and they were operating pretty well. The problem began around 5 years ago or so when a moratorium was put on hospices in California. So a bunch of bad actors came over the border into Nevada, and they've come to our state and set up shop. I only have 2 little slides because I'm going to keep it brief for us, but in slide number 1, do you have... Can you see? Oh, great. So in slide number 1, you can see that just in the last few years, this is mainly in Clark County that's been affected. I guess that's where the money is. It went from about 5 years ago, we had about 70 hospices, and now we have over 270 hospices. Huge influx. That's just in Clark County. These new hospices are no longer mainly nonprofit. They're mostly for-profit now. This growing number of providers has introduced unnecessary fraud and abuse that threatens the safety of most of the vulnerable members of our community. Most of the inspections are driven by complaints. Turns out that these are the best people to defraud because people who don't complain are people who are dying and family members that are so heartbroken that they don't even know who they would call and they don't report abuses. I've heard a lot of appalling stories. People are greed-driven, shortcuts, schemes to make more money. The fraudsters are taking advantage of regulatory loopholes. So, for example, hospices need to report if you have 50 clients. So they'll get 49 clients, start a new company, 49 clients, start a new company, and they'll get around having to do a lot of reporting. Also, people are being signed up for hospice when they don't even know they're signed up for hospice. And they're starting to bill Medicaid and Medicare without patients' knowledge. Probably the most horrifying thing is that dying patients aren't getting adequate care because these new hospices aren't well staffed. People are literally lying in bed in pain and in filth and not getting the care they deserve as human beings. These corrupt hospices wait until the care level is very high, right at the end of their lives, and then they dump them and transfer them to other hospices. Really, usually the way it works is a hospice takes care of the person from entry until the end of their lives, but there's been a disturbing trend where people are being dumped into other hospices right at the end because there's more work at the end. And this is my second little slide that shows that there's been an influx of transfers. You can see that we're already up to 16 this year, but 75 last year. These are just transfers to Nathan Adelson, which is the largest, oldest nonprofit hospice in the state of Nevada. So that's just that data. So many of us know the heartbreak of watching someone we love spend their final days in hospice care. We understand how sacred that time is, how much dignity, compassion, and integrity matter in those final moments. What's happening in Nevada is a betrayal of that sacred trust. Unscrupulous hospices are operating unchecked, exploiting a system meant to comfort the dying. While some of us have the strength and support to speak up for our loved ones, there are hundreds of people in Nevada right now lying alone in hospice beds with no one by their side, no family, no friends, and no voice, and they're counting on us to look out for their well-being. Today I have with me Dan Musgrove, who can go through the brief bill language.
Thank you, Chair. Dan Musgrove, Strategies 360 today on behalf of Nathan Adelson Hospice, and I want to thank Assemblymember Edgeworth for her passion and her commitment to this issue. AB 161 started out a little bit broader, and now I think it's a very focused and important bill that we would ask you to support. Really what it does is it provides for a patient's, hospice patient and family's Bill of Rights. you don't know what you don't know. And that's what we've really found out from just our experience as a nonprofit, that folks don't realize what they should be getting when it comes to hospice care. They don't know who to complain to. They don't, and very tragically, they don't really even want to think about it, because it's one of the worst times of their life as a loved one passes, and they don't even realize they've been taken advantage of. And I shared an email with you earlier in the week that showed that CMS at the federal level is really starting to get involved in this, but other states have taken action, and we would ask that you do the same. So really, I'd like you to focus on pages 4 and 5 of AB 161. And really what it does is it just requires that, first, that you get the informed consent of the patient for all treatment and all, or their family members, of all decisions concerning the care. You maintain that document so that if someone needs to go back to the state, whether it's HCQC or CMS, then those documents are present with those hospice companies to know that they were in fact given that information as to what they should be getting. Notice to the patient if for some reason that they're going to quit and no longer provide care, the hours, the contact numbers, so that family members know who to reach out to. And really, it's simple in that current statute shows that they should be getting medical care, skilled nursing care, intermediate care, custodial care, and palliative services. However, not all of these operators provide those services, and they're not informing their patients of what they should be receiving. And that's what this bill really does, is it requires that within 15 days that they're signed up, that they receive this information, and then know who to call when they feel that they need these services. We would ask for your support. As you can see, it's getting larger, and it's mainly in-home hospice care. And to the Assembly member's point, you can do a Google search or a search through the Secretary of State's website, and we have that information that we could share of the multiple businesses that are located at the same address. Multiple hospice care companies run by the same people. They're all individual businesses, all located at the same address. If you physically go to that address, there's usually no one there. There may be a security guard there who asks you who you're reaching out to, and they hand you a phone number. We hope that this bill will bring some clarity to patients and their families, so that they then can make these reports, so that we can identify who these folks are and take some action. So we appreciate your time today on a very busy week, and we're open for questions.
Thank you so much. Committee members, do we have any questions? Senator Titus.
Thank you, Mr. Chair. Thank you for bringing the bill forward, much needed. Just curiosity on the language. Is it mirrored after other states' language and regulations? And number one. Number two, you said CMS is looking at, and most of these are Medicare patients, or at least elderly, or on some sort of other insurance. Is there other federal regulation out there?
Dan Musgrove, it is specifically Medicare that usually is these folks are being signed up, because it is a very rich benefit, and it doesn't require a lot of information to be shared. That goes to that kind of that 49 and 50 patient threshold of what needs to go to CMS. CMS just did a recent sting where they got back about $400,000 worth of over payments or overcharges, but it's mainly CMS. This language is not based on anything else. This is what we worked with on the Assembly side, and also worked with the Department, Cody Finney's team, actually, to make sure, A, that it wasn't a huge fiscal note, and B, that it really was just giving the patient the mechanism to take what's already in statute that provides for hospice care, that is based on the CMS level, and then so that they're informed as to what they should be getting, and then require that provider, that vendor, to transmit that information to the individual, so they know what they should be getting.
Again, though, and thank you, follow-up, are there any states that have this wording, or how have other states addressed this?
Other states, actually, Dan Musgrove, as the assembly member said, California put a moratorium on no more new hospices until they got a handle on it. New York is currently looking at legislation that will outlaw for-profit hospice companies. They will only allow nonprofits in the state of New York. That's about all we've seen at this point. So it's a fairly new problem that is really affecting Nevada, Arizona, Texas, and California. Not a lot of the other states have seen the huge growth that we have here. And I think it's mainly because of our senior populations.
Thank you for that, but I think possibly one of the main reasons is that California has gotten a handle on it, so they're going to move here, and so we might want to alert Utah and other states, because it sounds like they'll find a place. Thank you, Mr. Chair.
Thank you. Any other questions? I had a quick one, and I apologize if it catches you off guard, because I think usually the questions we ask are relating to the current reprint, but I had more interest in the original print, and so perhaps you can answer my question for it. I know that there was a transition from it being a Bill of Rights, but during the interim and in this committee, I've referenced not just the proliferation of hospice care licenses, but also for home health care and monitoring the quality that patients receive, and perhaps if there's a proliferation of licensees that are not qualified to do the work that they're entrusted to do. And so I know in one of the sections of the bill, and again, this is why I apologize for not throwing you off guard, but I know it's the original reprint of section 11 that requires the board to promulgate regulations and so forth to look at essentially, excuse me, I'm like going through it. That essentially a program of hospice care must they must go through an independent review process for claims of deception, compliance with state law, et cetera, et cetera. I think this is an important piece of legislation. Even if the rest of the bill is not being proposed today, I think that you should at least consider this, because it certainly is pertinent to some of the issues we've seen in terms of consumer complaints. I don't know what your potential feedback is. It would mean that we can't work session your bill today, but we can give you time tomorrow to essentially bring something back as to maybe prescribing regulations to accomplish what you brought forth today. I don't know if there's any interest to that, but I certainly see the merit to it. So I don't know if the bill sponsor has any comments.
Thank you. Rebecca Edgeworth for the record. Originally, this was, as Dan Musgrove mentioned, it was much larger. Having additional inspections, which I think is the right thing to do, unfortunately not the right time, because there's a large fiscal note that would have been attached to it. So, and I should say that I plan, as long as I am allowed to come back, I will run a hospice bill every single session until something major gets done. This is a first step.
Senator, with your indulgence, Dan Musgrove. And to your point, one of the things that was a concern of a lot of the things that we were putting in the original bill was that we really don't have data showing that there has been a large amount of complaints. And it really goes back to the fact that people don't realize that they've been taken advantage of. And again, it's that time of grieving. And we've talked to folks and asked them to file complaints, and every complaint that they have filed, HCQC has looked at, but there just hasn't been the data to show that it's a problem, other than seeing what we are experiencing at Nathan Allison Hospice, the number of business licenses that are out there. And so we think that at least in the 2 years that this bill will be in place, that we hope HCQC will have that data showing that there is a problem there. So I think we had to walk before we could run.
Great. Thank you so much for that. Any other questions? Let's open it up for testimony and support. So I'll ask our bill presenters to step back. If you would like to testify in support of this bill, you may come forward. 2 minutes, of course, per person in the 15-minute cap. And we will begin here in Carson City. Please begin.
Good afternoon, Chair Dunyate, Vice Chair Taylor, Kayla Maese for the record, Kaylah Maese, Civil Rights Analyst with the ACLU of Nevada. And we support this bill, and we thank the sponsor for bringing it forward. Thank you.
Reverend Paul Larson, Paul Larson, Lutheran engagement advocacy in Nevada. On behalf of Lutherans across Nevada, and especially as a pastor here in Nevada, I strongly support and urge the support of AB 161. It is vital, especially at end-of-life care, the amount of past parishioners that I walk with on a daily basis who are in this process of transitioning into life, into care, that this is a very much needed piece of legislation to support our most vulnerable.
Thank you. Anyone else here in Carson City? I don't see anyone here in Las Vegas. AVH, is there anyone online?
To testify in support on AB 161, please press star 9 on your phone to take your place in the queue. Once again, if you'd like to testify in support on AB 161, please press star 9 on your phone to take your place in the queue.
Hello, Chair and members of this committee. My name is Catherine Nielsen. I'm the Executive Director of the Nevada Governor's Council on Developmental Disabilities. We feel that AB 161 strengthens protections in hospice care, an area where people with intellectual and developmental disabilities often face gaps in communication, consent, and continuity of care, particularly at the end of their lives. And requiring written informed consent and advance notice for care changes helps ensure that individuals with IDD and their guardians are included in decisions and not left behind during critical end-of-life transitions. And we appreciate your time today. Thank you.
Good afternoon. My name is Kim Anderson Mackey, Anderson Mackey, and I'm here representing Amore Hospice Care and Amore Kids as an administrator and owner. Additionally, I'm here representing the Department of Health and Human Services Advisory Council on Palliative Care and Quality of Life. And we would definitely like to support 100% this bill as it is written in AB 161 and thank Dr. Edgeworth for her support and bringing light to providing good hospice care in the state of Nevada.
Chair, there are no more callers in support at this time.
Thank you so much. Is there any opposition in Carson City or in Las Vegas? I don't see anyone here. AVH, is there anyone online?
To testify in opposition on AB 161, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you so much. Is there anyone that would like to testify in neutral on this bill? Seeing none, AVH, is there anyone online?
To testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you so much. Did you have any closing remarks, Assemblywoman? We'll go ahead and close this bill hearing, and we will move on to our next one, which is Assembly Bill 315, and I'll go ahead and open the hearing on this bill, and you may begin.
Good afternoon, Chair Dunyate and the members of the HHS committee. I am Rebecca Edgeworth, REBECCA, EDGEWORTH, and I have the honor of representing Assembly District 35, which is in Southwest Las Vegas. Thank you for the opportunity to present Assembly Bill 315. It addresses the growing issue of Medicaid provider fraud. I appreciate your consideration of the bill, and I'm trying to be very respectful of your time. And I'm going to do a very short presentation and not have other testimony from other departments, but there are people in the audience who can help me answer questions in case you have any questions. It's a pretty simple problem and hopefully a pretty simple solution. So we've all heard that Medicaid provider fraud is a rampant issue. It's costing the state and the United States millions of dollars every year. To be clear, I'm talking about provider fraud, people theoretically providing care. I'm not talking about chasing after Medicaid patients. So signing up for to be a provider of Nevada Medicaid care, such as a doctor or occupational therapist, physical therapist, that kind of thing, currently it's a largely unverified process. And for example, you can fill out paperwork pretending to be Dr. Rebecca Edgeworth. You can fill out paperwork. You can start billing Medicaid for visits that aren't happening. Medicaid can start paying for visits. And once the process of investigating fraud like this happens, often the criminals have absconded. Oftentimes the money can't be recovered. By simply verifying the provider's identity, we feel like it's going to be a lot harder to perpetrate this kind of fraud. I think we all agree that Medicaid dollars should be going to populations that really need the care and not going to criminals. This bill represents a collaboration between Nevada departments. Stacy Weeks, special guest Stacy Weeks in the audience today from Medicaid, she's been working for quite some time, I think, on a modernization, a biometric validation system that can be used for providers. I've also been working with the AG's office, who have Medicaid fraud investigators, and they are fine with biometrics, but they also wanted notarization to be available just in case they weren't able to access the biometrics. And this bill will simply require that providers have to identify themselves. I think the only people who might be bent out of shape about it might be medical providers, but this is something that they would need to do once every 5 years. And I don't think, for us to be saving millions of dollars of state money, I don't think that that is a lot to be asked. So again, in the interest of time, I'm not going to go into a lot of the testimony that we had before. Stacy Weeks, again, is here. Hopefully I would have any answers you'd have. With that, I'm happy to answer any questions.
Thank you so much. Any questions, Senator Titus?
Again, thank you for bringing this forward. I too have grave concerns about Medicaid and Medicare fraud, and this will hopefully alleviate some of that. I'm wondering about how long it would take to implement these changes. The effective date of the bill is July 1st, 2025, and I know that Director Weeks is working on, and I know there's trying to get this going, but how long do you really think this would take to get this set up?
Rebecca Edgeworth, for the record. Notarization is already available, both electronic and wet signature notarization. So that's the worst case scenario that we would be doing that. Does Stacy Weeks have any timeline on when the modernization? I knew you would have to come up. I'm sorry. Okay.
Good afternoon. Stacy Weeks for the record, Nevada Medicaid. Yes, we're in the middle right now of getting the biometric process in place online. We think by the end of summer, providers can use that process, but they still will have an option if they want to get a paper application and go through a much longer process and then get it notarized. But we're hoping that it'll be quicker, real time, much easier online through the biometric process.
Very good. Thank you. Thank you, Mr. Chair.
Vice Chair Taylor.
Don't go away. Please. Thank you, Chair. Just give me an example. What does that look like? Let's say I'm a new provider, just opening up a clinic or something. I don't know, whatever. And I want to get. Well, I need to be verified and so on. What's that process look like? I want to do it online.
Stacy Weeks for the record. Currently, it's a lot longer process, but right now, like I said, we're doing this provider revamp for our provider enrollment. So every provider we pay has to be enrolled in our program. They submit an application. It's pretty detailed. As Senator Titus is shaking her head, she knows. Because of fraud and all the other things, we've had to jump hurdles around to try to make sure our program has integrity. But what essentially it will do is it allows to do more like pictures. It captures, eye patterns, all the things that you would see at the airport, to do it online and to make sure that the individual actually signing the application is the individual. So there's also sending in, I think, a picture of your ID. But again, if someone's not comfortable with that process, they can get a paper application, but we will be probably charging a small fee just because it is going to take us additional time and staff. We're trying to move away from the burden, both on our side and the provider going forward.
Follow-up, Chair. Thank you so much. Just as a follow-up, my understanding of Medicaid and Medicare fraud, that the majority of it comes on the provider end, much more so than someone saying, I'm going to the doctor, but I'm really not.
Stacy Weeks for the record. Nevada Medicaid, yes, that is correct. We see the majority of fraud being on the provider payment side. Some intentional and some unfortunately just happens and mistakes happen. But intentional fraud is what we're trying to stop here. It's bad actors.
Well, thank you very much. Thank you, Chair. And I applaud you, Doctor. Thank you for coming forward with this. Thanks, Chair.
Any other questions? All right, let's go ahead and open it up for support testimony. If you would like to provide support testimony, we ask for folks to please come forward. I don't have anyone here in Carson or in Las Vegas. AVH, is there anyone online?
To testify in support on AB 315, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in support.
Thank you. Is there anyone in opposition to this bill? I don't see anyone here or in Las Vegas. AVH, is there anyone online?
To testify in opposition, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. And last but not least is neutral. Is there anyone in neutral on this bill? Go ahead.
Thank you so much, Chair Dunyate, to members of the committee. For the record, Teresa Benitez-Thompson, Chief of Staff to Attorney General Ford. We house the Medicaid Fraud and Control Unit within the Office of Attorney General. It's housed within the Offices of Attorney General per Social Security statute, federal statute. And so we are the ones that get to do this work. AG Ford's committed to Medicaid fraud and taking down fraudsters. We've supplied throughout different committees a number of different reports on our activities. So depending on what you'd like to know, we'd be more than happy to send information to you when we want to thank the bill sponsor for working with us on some language in this bill.
Thank you. Anyone else? I don't see anyone else here in Las Vegas. AVH, is there anyone online?
To testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you so much. Did you have any closing remarks? Let's go ahead and close this bill hearing and move on to the next one, which is Assembly Bill 380. And I'll go ahead and open this bill hearing, and we'll invite our sponsor back to present when she's ready.
Thank you, Chair Dunyate and members of the HHS committee. I'm Assemblywoman Rebecca Edgeworth, REBECCA-EDGEWORTH. I represent Assembly District 35, which is in Southwest Vegas. Thank you for your extreme patience in listening to the same person talk for so long. I apologize. Thank you. Thank you also for the opportunity to present AB 380. This bill makes changes to the requirements for mobile crisis teams to allow them to be efficient and flexible when responding to members of the community who are having behavioral health crisis. I was originally approached by Las Vegas Fire, present at the table up there. They asked me to sponsor the bill, and they worked well before I was elected. They've been working with lots of different stakeholders in the state, and we believe that this is going to benefit the entire state. Fortunately, I have my subject matter expert right up there. I was going to have another person with me, but that's okay. Let's see how I do. All right, so to provide some background, the 988 crisis response system was created during the 2021 legislative session, and Nevada legislators have been working on it ever since. We've been tweaking it to make it even more effective for Nevada. This system includes a 988 crisis and lifeline phone call that you would make, and it provides individuals with mental health distress immediate access to a crisis counselor. If needed and available, there's also mobile crisis response teams that can be dispatched. These teams can provide crucial intervention and short-term support. The services have been proven to show they have decreased emergency room visits, and they also have decreased incarcerations. And they ensure that Nevadans have access to appropriate care. As a physician working closely with underserved communities, that's mainly what I do, I often encounter people in moments of deep crisis when pain is overwhelming and support feels out of reach. These experiences have made one thing perfectly clear. For those who are most in need, timely intervention isn't just important, it is life-saving. Currently, when a call comes in through the 911 system, dispatch determines what the appropriate response is. If it's anything dangerous, police would be sent. Of course, if it's anything medical, an ambulance or paramedics would be sent. But if it's simply someone who's having an isolated mental health crisis, then ideally a more appropriate response could be sent. Some municipalities, the large municipalities, already have things like this. Washoe County has their mobile outreach safety team, which they call MOST. Las Vegas City Fire has Crisis Response Team, CRT. Las Vegas City Metro has the Crisis Intervention Team, CIT. These are teams of specialists that go out, do hands-on personalized assistance to those who are in need. Ideally, we would have the ability for all municipalities to have these access to these kind of teams to help Nevadans. This bill is urgently needed because, as currently written, when someone triggers their crisis response through the 988 system, a very particular team of individuals is deployed. This bill will allow for a more flexible response to align with what we're already doing on 911. Also, this will allow for the crisis response team to be reimbursed through Medicaid, and this way smaller municipalities who haven't been able to have a team like this will be able to be reimbursed and hopefully would be able to afford to have this throughout the state. I have Assistant Fire Chief Arthur Perillo from the City of Las Vegas Fire in Las Vegas, keeping an eye on things, and he has some specifics for what the bill will provide.
Thank you, Assembly Member Edgeworth. Art Perillo, ARTPERILLO. Thank you, Chair and members of the committee. Out of respect for your time and busy schedule, I believe each of you have been provided a copy of the presentation that was submitted or given to the Assembly several weeks ago. I would just like to provide a short summary just to save some time. First, I want to thank all who support the bill for your leadership in advancing Assembly Bill 380. This bill is a pivotal step forward in strengthening Nevada's mental and behavioral health crisis. The changes outlined in AB 380 expands access to mobile crisis intervention teams by allowing greater flexibility in how these teams are staffed. This is vital for our state because urban and rural communities face very different resources and response challenges. The bill empowers jurisdictions to build teams that meet local needs, whether that means pairing behavioral health professionals with peer support specialists, medical providers, or law enforcement. Last year, Las Vegas Fire and Rescue's crisis response team responded to over 3,400 incidents. This bill will allow us to increase the number of patients we can serve annually. This flexible, community-centered approach helps ensure that all Nevadans in every corner of the state get the right care at the right time from the right team. Thank you for your thoughtful response and leadership. And if you have any questions, I'll be more than happy to answer your questions.
Rebecca Edgeworth, for the record, I'm ready for questions.
Thank you so much, and thank you for that presentation. Committee members, do we have any questions? I don't think we have any. If you want to take a step back, we'll open it up for testimony. If you would like to provide support testimony for this bill, please come forward. Got a few folks. You may begin.
Thank you. Good afternoon, Chair and members of the committee. I am Amy Hines Sutherland, AMYHYNE-SUTHERLAND. I am the Health and Human Services Manager for the Nevada Association of Counties and also here today on behalf of Washoe County. Nevada's counties are in support of AB 380 because the bill ensures that we can develop the crisis teams that our communities have the capacity to develop. It's a workforce flexibility issue. Every community looks a little bit different, and this bill enables all of our counties to develop the teams they need. Thank you.
Okay, hello, Chair Doñate and members of the committee. My name is Carissa Pierce, CARISSAPEARCE, here to represent Children's Advocacy Alliance, and we are in strong support of this bill. Thank you.
Good afternoon, members of the committee. My name is Alex Ortiz, Alexortiz, representing Clark County. Also here to deal with some of the comments made by the previous testifiers and support this bill. Thank you.
Good afternoon, Chair, members of the committee. For the record, Trevor Parrish with the Vegas Chamber, here in support of AB 380. And we view this proposal as a means of supporting the vital industry of mental health care, and will support the communities that are most in need. Thank you for your time and support.
Good afternoon, Chair and the committee. Ryan Beeman, representing the professional firefighters in Nevada. Ditto a lot of the already the comments. It really does get the right resources to the right call, and we support this bill. Thank you.
Good afternoon, Lindsay Knox with McDonald Carano, here representing REMSA. Ditto to the previous comments.
Thank you. Anyone else here in Carson City? Let's go to Las Vegas, please.
Thank you, Chair and committee members. My name is Lisa Kelso, Lisakelso. I'm with the City of Henderson Mobile Crisis Intervention Team, and I'm a licensed mental health clinician. In 2022, the City of Henderson launched a mobile crisis intervention team staffed by licensed mental health clinicians. We take referrals from police, fire, and medical providers for people experiencing behavioral health crises. We support AB 380 and the intent to prioritize a crisis response with licensed behavioral health and medical professionals. We are working with the 988 rollout process to continue to align our team to be eligible for Medicaid reimbursement and to coordinate on the development of a regional crisis response system. We've implemented evidence-based practice to respond appropriately to behavioral health crises and deflect patients from both criminal justice systems and emergency rooms. Best practice for a response to people in crisis is a medical response, and although our team does contract with peer recovery support specialists, we agree they can be a follow-up referral and do not need to be required in the initial response. We think AB 380 allows for flexibility for cities to structure their crisis intervention teams according to their needs, and we look forward to being a part of the state and the region's efforts to serve people with behavioral health needs appropriately.
Thank you so much. Anyone else in Las Vegas? AVH, is there anyone online?
To testify in support on AB 380, please press star 9 on your phone to take your place in the queue.
Good evening, Chair. My name is Catherine Nielsen, and I'm making these comments today on my own accord. We've unfortunately had several instances where we've needed to call the local MOST team here in Carson City. In 2022, my husband had his amygdala, hippocampus, and right temporal lobe removed, which means he's in constant fight or flight. And this team has saved his life multiple times. I urge you to support this measure and help the areas that deserve this support as well. Thank you for your time.
Chair, there are no more callers in support at this time.
Thank you so much. Is there anyone in opposition to this bill? Seeing none here in Las Vegas, AVH, is there anyone online?
To testify in opposition on AB 380, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you so much. And moving on to neutral, is there anyone that's in neutral on this bill? Please begin.
Good afternoon, members of the committee. My name is Helen Foley, and today I'm representing T-Mobile. Several sessions ago, your own Senator Julia Ratty created the 911 system, and it is paid for from a surcharge on all telecommunications services. At the beginning of this session, very early in the session, Assemblyperson Edgeworth came to all of us within the telecom industry and said, I want to better define those teams that come together so that it's not just police, that we have the best people possible to divert any type of unfortunate situation with those that have a mental health crisis. This does not increase the tax that is currently being paid by all of you on your cell bills, and I think that it's necessary and it's a wonderful thing. But I really want to thank her for coming and calming all of us down that there would be a tax increase, because there isn't. So thank you very much.
Thank you. Anyone else in neutral? AVH, is there anyone online?
To testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral.
Thank you so much. Did you have any closing remarks?
Rebecca Edgeworth, for the record, thank you very much for your time. I appreciate it.
Thank you so much. At this time, I'm going to go ahead and close the hearing on this bill, and we're going to take a quick minute recess because I have to talk to the Assemblywoman. All right, welcome back, everyone. We have one more bill up for hearing, which I'm about to start, and then we'll do one short recess after that hearing just to get our ducks in the row, and then we'll do one final work session for the bills that were heard today. And obviously, I mentioned that we have a work session tomorrow, but depending on how we go through, how quickly, hopefully we can be pretty effective. So at this time, I'm going to go ahead and open up the bill hearing for Assembly Bill 448. This bill revises provisions relating to insurance for vision care, and I will invite our Assemblyman to begin when you are ready.
Thank you, Chair Donate, and thanks to the Senate Committee on Health and Human Services for taking the time to listen to us today. My name is Greg Koenig. I represent Assembly District 38. This is only my second session, but I can say that this has been my most difficult, challenging bill that I've ever carried. In fact, I was a little bit nervous and scared to come up and be here today. So, last session, Senator Severs Gansert carried a bill that addressed a lot of what's in here. And so the thought was there were a few things, extra things that had been left out or that we wanted adjusted, and that was kind of the genesis of this bill. And then I think it maybe turned into a little bit more than that. But, this bill passed through the Assembly unanimous, and there was maybe a couple of people in opposition in the hearing, but no one ever came to my office and, complained and said, let's fix this, this isn't good. And then it gets over to the Senate side, and all heck breaks loose. And so, I was admonished or advised that we needed to work together and try to come up with some sort of compromise. And so I got exposed to what compromise means in this building. So I had a 45-page bill that the people who were opposed to this bill, the first meeting handed me a piece of paper, a single sheet with 2 paragraphs, and they wanted me to get all 45 pages of mine and replace it with 2 paragraphs, which I guess is a compromise, but it wasn't one that I was all the way excited about. But I worked really, really hard on this bill. I think I might have achieved a compromise because the State Optometry Association is irritated at me for everything I took out, and the insurance companies who are in opposition are irritated with me for what I left in. And I don't know if you guys have the latest mock-up, but the color of this mock-up is purple. If you look at page 6 and 7, there's not a single thing on there that isn't purple. So I really pared that down. I took out more than 75% of the bill, and we ended up with, at this point, we ended up with 3 things left that we were asking. So I sacrificed everything else in the bill and came up with 3 things. I think the opposition can maybe stomach most of them. I think they're, like I said, I don't know that they love it, but I think they might be able to live with it. So I'm going to turn the time over to this way. I'm going to turn the time over to Rick to explain the 3 things that we have left in this bill.
1, 2, 3. Good afternoon, Mr. Chairman, members of the committee, and staff. For the record, my name is Rick McCann, M-C-C-A-N-N, and today I'm representing the American Optometric Association to help present this AB 448. If you look at the bill, I'm going to reiterate a little bit of what just been said. If you look at the bill that was presented before the Assembly Committee on Commerce and Labor, which passed the floor 42-0, the bill before you now is quite different. Painstaking efforts have been made to accommodate the desires of the opponents of this bill, for good reason. They have interest, they're stakeholders, when they surfaced after the bill was assigned to this committee. Lots of purple and a little bit of good green, too. So we'll talk about the green. To be sure, this bill did start out and continues to be an unfair trade practices bill. At the heart of the bill is an intention to provide fair, accessible, low-cost vision care to patients throughout Nevada. It deals with vision benefit managers, or I think we're calling them now providers of vision insurance. I think that's the name we have now. That contract with vision providers or optometrists to provide and pay for vision care. let's take a look at those big three we just talked about here, the specific provisions of the bill. Real quickly, sections 2 through 17 offer definitions to words and terms that are used in the bill. Pretty standard stuff. I'm not going to go through that for you. Section 28 prohibits a provider of vision insurance from controlling the professional judgment of the optometrist. Well, there's a noble idea. Seriously, we shouldn't have any problem with that. We don't want outsiders controlling. Dr. Titus doesn't want outsiders controlling the best interest of her patients when she does stuff. We don't want that. That's what that portion of the bill is all about. We don't want outside influences that are not of the patient's best interest. Section 28 also prohibits the provider of vision insurance from withholding or seeking a recoupment of payments that the optometrist received when he or she treated a patient if the patient was shown by the provider of vision insurance's own data to be enrolled in the plan. They called, they found out that Senator Taylor happens to be an enrolled person. Yeah, cool. Go give them the services, go give them the materials, go give them what we need. But if the vision plan later determines on their own that their own data was incorrect, that the patient was not enrolled as they thought, the optometrist has already provided the covered services or provided the covered materials. So why should the provider of vision insurance take money back from the optometrist due to the plan's error? That's not fair to the optometrist, certainly. And it's also a disservice to the patient, we believe, since it places kind of a wedge between the patient and the optometrist over who's paying for this error. Section 28 also prohibits the provider of vision insurance from requiring a reimbursement of money from the optometrist if the optometrist uses his or her own laboratory, supplier of contact lenses, glass frames, management software, etc. It's all listed within that portion of the bill. Now, if I'm Dr. Koenig's patient, I want him to decide who, what, when, and where my vision needs are handled and met. Not a plan that sells all these needs based upon their own profit margins, quite frankly. Section 30. It says if a provider of vision insurance offers more than one plan, it cannot require the optometrist, as a condition to participating in that plan, to also have to participate in other plans. If Dr. Koenig sitting here wants to be a part of a plan, he should be allowed to be a part of that plan. Don't make him participate in all plans just to be a part of one of them. That's just not fair. Section 3.1 simply says that provider of vision insurance must include a copy of its manual and policies referred to in any contracts with the optometrist. Really? That's a big deal? I don't think so. I don't think we're going to have any problems with that. And then section 31.5. It simply states what I think is the obvious. If a contract between the provider of vision insurance and the optometrist violates the law, it's unenforceable. We shouldn't have to put that in there, but we do because of some events of the past. Now, on that section, put a pin in that one, because I believe we are replacing it with a couple of words that may be different in the language I think that we've come up with the stakeholders. And that came from discussions between all the stakeholders, I don't know, 2.5 hours ago. That's how long we've been working on this up until just before this hearing. That's the bill. It's patient-driven. It's not profit-driven by a provider of insurance, vision insurance. It's filled with concessions, excuse me, by the optometrists that have caused some pain for them, I will tell you. I watched it. And it will not offer all of the best interests and benefits to the patients. But we hope we are making some small progress toward the best interest of the patients. And by the way, if you look on Ellis, I think there's about 175 positive comments that have been made on this bill so far. We don't want perfect to become the enemy of good. So we've worked hard to get good, and we won't have perfect, sorry. Ladies and gentlemen, with that, Dr. Gergson and myself and Dr. What's your name again? Greg. Will answer any questions you may have. Thank you.
Thank you so much. Committee members, do we have any questions? I'm going to take a stab at a first question just so that the committee members don't get confused. So there are two amendments that are uploaded on Nellis. The amendment there's the first one, and give me a second because I'm going to go through it. There's the mock-up, right? And then there's a second one, which is the one that says about, hold on, give me 1 second. One second, I'm trying to go through different screens. There's the mock-up amendment, and then there's the other one that we cannot do, right? There's two of them. One of them is the actual mock-up. The other one is just a Word doc, right? In your testimony today, you have documented that there is perhaps another amendment. So can you walk us through what the provisions of what the deletions are based on the mock-up? That's the one that the committee members have.
Rick McCann for the record. If you take a look at section 31, on the mock-up, that's what we're dealing with, the mock-up. On section 31.5, in the green language there, it says, in addition to any other remedy provided by law, starts with that. We're playing with that language here. It's going to say what it says, but we've got a couple of different language changes on that. It's my understanding, and if I'm wrong, I believe the stakeholders will come up and tell me that I'm wrong. But I believe it's going to be 31.5. We'll have some different language to replace that. It's going to say the same basic thing, but we've decided some words are a few other words are better.
Greg Koenig for the record, and Rick actually came up with the amendment, but I think basically what it says is that any contract, current or future, must abide by any law that is current or future. So what that is doing, so if you signed a contract 20 years ago when none of these laws existed, you're not exempted from the current laws. It'll say that current or past contracts must abide by the current or future laws. I think that was basically what it said. We need to get a lawyer to write it. But I think that's what we agreed to.
Rick McCann for the record. I believe that Senator Taylor has my copy of the language that I left with her a little bit ago. I didn't get another copy, so I think she's sharing it with some of her colleagues right now.
Yeah, and and just to be clear, it's also on Nellis as well for the committee members if they. No, that's not what we're referring. Hold on.
Yeah, that's what he was just referring to.
Rick McCann for the record. Yes, at the bottom there in the green language, circled number 4. That I think is kind of what we're going to supply.
Let's start from the scratch. Sorry, this is a little bit. I know it's deadline week.
I'm horribly confused.
Let's take a step back. Okay. There are 2 amendments on Nellis. There is one that is a mock-up, and then there's a separate one which is a Word doc. We cannot do the Word doc because of legal issues, so we're only going to focus on the mock amendment. I received, based on discussions today, there was a conversation as to a proposed amendment to this bill working off of the mock-up that would delete Section 25, delete Section 28, subsection 4D, 4E, 4F, 4G, delete Section 31, except for the current 31.5, and it would amend that 31.5 to say, upon passage of this bill, all such provisions contained in the bill, together with the current and future laws, shall be included in each existing and any future contracts between a vision plan and a provider of vision care. And then that Section 50 would be amended to read that this bill becomes effective on January 1, 2026. So that is the amendment that I believe is not uploaded or in reference, but I just want to make sure, was that amendment agreed to, or what was the case?
Greg Koenig for the record. Can you go through that one more time? You were faster than I could turn the page, and so I want to make sure that I catch everything that you just stated.
Sure. So there's an amendment that's not uploaded that was just discussed prior to we opening up the hearing. That it was my understanding that, again, we're working off of the mock-up, that so if we're working off of your mock-up, the second amendment that we would do is we would delete all of Section 25. And the reason why we're deleting that, just to be clear for the record, is because there's a current lawsuit in a separate state, and so we would put ourselves in a similar lawsuit. We would delete Section 28, subsection 4D, 4E, 4F, and 4G. And then we would delete section 31. And section 31 is the one that deals with contracts. We would keep section 31.5, but instead amend it to say that upon passage of this bill, all such provisions contained in the bill, together with any future laws set forth in this chapter, that they should be included in each existing and any future contracts between a vision plan and a provider of vision care. And then the last one is that it becomes effective January 2026.
We'll agree to that, yes.
Okay, thank you.
Craig Koenig for the record.
I just wanted to be clear of this portion, because I know that this conversation is not formally an amendment, but it was my understanding that it was clear. Okay.
So does that make sense?
That paper is not
Right.
an
No,
amendment.
this,
Yeah.
no, this is just what you read, which is, I just want to know, is that the last piece you read that gets added, is it 31 point something else? Because you said instead of 31.5, it's 31.
Let's take a quick minute recess so I can print this, and then that way the committee members can have time to digest, because I think that's going to influence their questions.
Thank you.
Yeah.
Thank you. Then
Okay, we're back. So, just as a recollection of where we left off, we are working off of the mock-up amendment plus the one that I just delivered that will be uploaded on Nellis, but all the committee members all have the same documentation, so we understand of what we're talking about. Okay. Anything else that you would want to mention before we start any questions?
No, Greg Cohn, for the record, that amendment's exactly what we were looking for.
Great, thank you. Committee members, any questions? None? I just want to say that I know this process has been difficult, and obviously there's a lot of moving pieces with the expectation of deadline week, but I certainly appreciate the efforts that you've done on this bill. I know it hasn't been easy, but I think we'll hear the testimony. So let's go ahead and take some time, if you can step back, and then we can bring folks forward. If you would like to testify in support of this bill, please come forward at this time.
Good evening, Mr. Chairman. For the record, Danny Thompson, Thompson, here today representing IBW 1245, IBW 396, Operating Engineers Local 3, Operating Engineers Local 12. We're in full support of the amended version that you spoke of, and specifically the last part that you don't have, that is conceptual at this time, that would force these plans to follow the law. So we urge your support. Thank you.
Good evening. My name is Dr. H. Kenneth Kopolow, Kopolow. I've been practicing optometry in Las Vegas for 33 years. I have a brief thought for you as patients, as consumers of eyewear and consumers of eye care, to just give you something to think about while deciding whether or not to cast your vote in favor or in opposition of AB 448. This thought was provided to me not long ago by an industry insider. Think about had you purchased a television 5 years ago and paid $700 for that TV. I would suggest that same TV with that same level of technology from 5 years ago would probably cost you around $300 right now. And that's because technology has evolved, and there's a lot better and a lot more robust technology out there, and that's really true for eyewear as well. It's changed somewhat, but eyewear, the natural process of free market does not apply, and I'd like you to think about for yourselves what role may vision insurance plans play in the fact that eyewear prices have not come down for essentially the same thing. In fact, they've gone up. So my point being is that think about what these plans are actually doing, all the while that they're screaming about saving money and not raising costs. But in fact, almost every free market industry saves money as time goes on, as new technology replaces old technology. And I just personally, as your own experience, being a patient of an eye doctor, being a patient of an optometrist, just think about what, if any, impact vision insurance plans may have had in that role. Thank you, and have a great evening.
Thank you so much. Anyone else in Carson City? Anyone here or in Las Vegas? AVH? Anyone online?
Testify in support on AB 448, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in support at this time.
Thank you so much. Let's move on to opposition. If you are opposed to this bill, please come forward.
Hi, thank you for your patience with this. I know it's been a little bit crazy. My name's Lisa Ann Hurt Forsyth, and I actually represent the National Association of Vision Care Plans. We have not been privy to the discussions that have happened over the last couple of hours, which has been difficult for us, despite the fact that we have been involved in the process since it was in the Assembly. So that's been a little challenging for us to keep up. And I know it has been for you guys as well, as things have changed so quickly. At this point, we're just going to say that we're at a soft oppose, only because we have not had time to fully digest the proposals that have been put forth and run it past the members of our organization. We have 15 different plans, and we just need a few minutes to talk to them about what was just constructed, and we may be able to be neutral. I just don't know yet at this point. So we're sticking with a soft oppose for now.
Thank you so much. Anyone else here in Carson? I don't see anyone in Carson or in Las Vegas. AVH, is there anyone online?
To testify in opposition, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. Before I go to neutral, there are copies of the amendment if anyone from the public would like them. They were placed on the side, so if you want to read the one that we were just in discussion, it's available for you here. And last but not least, let's move on to neutral. Is there anyone that would like to testify in neutral? Please come forward.
Hi, my name's Melody Healy. Chair Donati, thank you for having me today. And members of the committee. My name is Melody Healy, MELODYHEALY, and I am a Senior Vice President of Operations for VSP Vision Care. I want to thank both the chair and the bill sponsor for working with us to address some significant concerns we had with the language as the bill that was originally presented. I am testifying neutral based on the new amendment described here. Our goal is we look forward to reviewing the official Nellis legislative text with the goal to move to support. Thank you very much.
Chair Giannate and committee, for the record, Shelley Capurro, representing the Nevada Association of Health Plans. We're in neutral here today because we are still getting feedback. We're still trying to look at the amendments. We're hoping to get to neutral, but in terms of the final language, so that's we're hoping where we land, but we're still in these conversations. But thank you for your time.
Thank you, Chair Dignate, members of the committee. Adam Plain, Plain, with the Nevada Division of Insurance. I did submit written testimony. I think after reviewing the mock-up and the amendment that was addressed or discussed in concept has mooted most of those items. But I did want to bring up a couple small technical things. Most people don't know, but the division does regulate endowment cemeteries and pet cemeteries under Chapter 452, as well as funeral and burial contracts under Chapter 689. Reviewing the bill, it looks like sections 42 and 43 make changes to funeral and burial contracts in Chapter 689. Would suggest maybe that's not the best spot to hit in this particular vision bill. Additionally, it looks like we've got some changes to applicability in like 695C dealing with health maintenance organizations, but we're missing 695B.320 dealing with nonprofit hospital, medical, and dental corporations. So I might suggest potentially adding in 695B.320. And finally, Section 14 provides a definition for a vision benefit discount plan that would be added to the unfair trade practices chapter. Just as a point of reference, discount plans, whether it's vision, dental, or medical discount plans, typically not considered insurance and not subject to regulation by the division. So even though a definition for a vision discount plan would be going into Chapter 686A and giving the impression that the division would regulate the discount plan, I don't believe there's express authority for the division to regulate those discount plans even with its inclusion in the bill. Happy to answer any questions.
Thank you. Any questions? May need to come back offline. Thank you. Please begin.
Good afternoon, Chair, members of the committee. Chelsea Capurro here on behalf of the Health Services Coalition. First and foremost, we want to thank the sponsor. I think through all of this, even with our disagreements, he's been great to work with and heard us out. And to his point, maybe if we're all a little bit unhappy, we've got a good piece of legislation. And then I think we probably need to have some conversations with the Division of Insurance to make sure that everything looks good. But we appreciate the sponsor. We appreciate the amendment. And with that, we are neutral. Thank you.
Thank you so much. Anyone else here in Carson? Anyone in Las Vegas? AVH, is there anyone online?
To testify in neutral, please press star 9 on your phone to take your place in the queue. Caller with the last three digits, 006. You are unmuted and you may begin.
Good evening, Chairman Donati, members of the committee. Thank you for the opportunity to comment on AB 448. My name is Richard Jones. I'm representing the Guardian Life Insurance Company of America, and we appreciate all the work that's been done on this bill to significantly improve it, and today we will register a neutral position. Thank you again.
Chair, there are no more calls in neutral at this time.
Thank you so much. Does the bill sponsor have any closing remarks?
Thank you, Greg Conner, for the record. I just want to thank everyone involved in this process. It kind of helps renew my faith in this system. If you'd have told me a week ago that we were going to be up here with all the people that we're arguing with, that they would be neutral, I don't know that I would have believed that we got here. And so thank you especially, Chair, for your part in this and for getting us together and for working it out, and just appreciate everybody. Thank you.
Thank you so much, and thank you for being here. I'm going to go ahead and close this bill hearing, and we will go to a short recess just to deliberate really quickly. All right, everyone, welcome back. After deliberation with the committee members, we have decided that we will work session 448 tomorrow, just to give everyone time to read over the bill language, given that there were different amendments proposed. For folks, of course, we will make sure that we upload the amendment online so that everyone has a chance to review and reflect and so forth. But we have a meeting scheduled for a work session tomorrow, so you'll see that reflected. So forth, it's just more time for the committee members to actually understand what they're voting on. But we are going to actually work session 161, 315, and 380. And so I don't think we need to do any description from Ms. Cooper. There are two of these. Two of these are amend do pass because our vice chair would like to be added as a co-sponsor of the legislation, and I believe our sponsors agreed to that. And so I'm going to go through each of these individually. I will let our vice chair do the motion, and then we'll go to the vote. So let's start with AB 161. Vice Chair Taylor.
Thank you, Mr. Chairman. I move that we do pass with amend. Amend do pass, not do, yeah, amend do pass, Assembly Bill 161.
Thank you. We have a second from Senator Stone. We have the motion to amend do pass. The amendment is just to add Vice Chair Taylor as a co-sponsor of the bill. Any discussion on the bill? All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will assign that floor statement to Senator Taylor. Let's move on to Assembly Bill 315. Vice Chair Taylor.
Thank you, Mr. Chairman. I move that we amend and do pass Assembly Bill 315, adding myself again as a co-sponsor.
Thank you so much. We have a motion from our Vice Chair, seconded from Senator Stone. Any discussion? All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will also assign that floor statement to Senator Taylor. And then last but not least, Assembly Bill 380. This is a motion of do pass. Do I have a motion? So moved. We have a motion from Vice Chair Taylor, seconded from Senator Lang. Any discussion on this motion? All those in favor of this bill, please say aye. Aye. Any opposed? Motion's carried, and I'll give that floor statement to Senator Stone. And that concludes our work session for today. And all. Oh, Senator Lang.
Assembly member, I would just like to compliment you on the work you did on your bills. They were very well done.
We will definitely ditto that. And thank you so much, Senator Lang. We have arrived to the last agenda item of today, which is public comment. So if there's anyone that would like to provide public comment at this time, we ask for you to come forward. I don't see anyone here or in Las Vegas. AVH, is there anyone online?
Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. Just as a quick heads up for those who are still watching, we have a meeting scheduled for tomorrow. I don't know what time it'll be. It'll be probably early in the day. It'll be mostly a work session. And then we did get referred several bills, but the only one that we'll be hearing tomorrow is the one that that was referred to finance. It's a budget implementation bill. I think it's SB 466. I just wanted to double check. So we'll probably do the hearing tomorrow, depending on logistics, but for sure we'll have the work session at some point with the bills that were left off today. And with that, thank you so much for joining us, and the meeting's adjourned.